friends, I am Dr. S. Mondal, BHMS Honours Consultant Homeopathic Physician. Today I want to discuss another very important rheumatological and pediatric topic is rheumatic fever. This video is basically for my non-Bengali follower and subscriber. Today's topic is the rheumatic fever. Rheumatic fever is an inflammatory disease and it is developed due to infection by group A Streptococcus bacteria. Most often affect the children, the ages 5 to 15 years old, younger children, and adult may be developed. In case of adult, may be developed. What are the causes? Causes the infection of a bacteria called the group A Streptococcus, and after that, this mistakenly it is an autoimmune process, and body's immune system is mistakenly attack the joint and the heart muscle and cardiac muscle. What are the risk factors for developing the rheumatic fever? First of all, the genetic predisposition. Genetic predisposition, gene is another very important factor, or genetic predisposition or familial predisposition is a very important factor for developing the rheumatic fever. Another is the specific type of bacterial infection. Group A Streptococcus are more commonly prone to infection, those type of people who have a genetic predisposition. And environmental factor, and a greater risk for rheumatic fever is associated with overcrowding area, like as the station, platform, school, bus stand, where a lots of people are gathering, or overcrowding area. What are the symptoms of rheumatic arthritis? What are the symptoms? And rheumatic fever symptom result the inflammation in later stage, the inflammation of the heart, joint and skin, or central nervous system may be affected. And after the infection of group A Streptococcus, symptom can be developed 2 to 4 weeks. And what are the symptoms? Fever, painful and tenderness of the joint, especially the knee joint and ankle, elbow or wrist joint. Most important symptom of the rheumatic fever is migratory type of joint pain. In the morning, patient complain pain in the wrist joint. In evening, on that day, in evening, patient complain pain in the shoulder joint. Pain migrate from wrist to shoulder. And after one day, patient complain pain in the elbow joint, and another day, after one day or another day, patient complain pain in the knee joint. And this type of migratory type of joint pain is a very most common, remarkable distinguishing point than other type of arthritis, like as the osteoarthritis, uric acid osteoarthritis, and gouty arthritis or rheumatoid arthritis, etc. And after that, the red hot swollen joint and chest pain, fatigue, flat and slightly raised or painless rash, heart murmur, and another very important symptom of the central nervous system, that is called the Sydenham chorea. What is Sydenham chorea? It is a jerky, uncontrollable movement, body movement. This is a jerky, uncontrollable and body movement, that is called Sydenham chorea, most often in the hand, feet and face. An outburst of the unusual behavior such as the crying or of inappropriate laughing. When the causes, when situation for crying, the patient laughing. An outburst of unusual behavior such as the crying in inappropriate laughing. This type of symptom according to the Sydenham chorea, and accompanies with Sydenham chorea. A small and painless bump beneath the skin, and some skin symptom may be appear. When to see a doctor? When the sore throat and associated with sore throat, pain and swelling, headache, fever and stomach pain, some gastrointestinal symptom may be included. What are the complication of the rheumatic fever? It is basically affect the heart muscle, and that condition is called rheumatic heart disease or RHD. And between the two chamber or left atrium to left ventricle, there is a valve that is called the mitral valve that can be damaged. Narrowing of the rheumatic fever can cause the following types of the heart damage, like the narrowing of the heart valve or valve stenosis. That condition is called mitral stenosis. This is a very important, and that is called mitral stenosis or valve stenosis, and causes the decreases the blood flow. Another condition, a leaky heart valve or valve regurgitation. In this condition, the backflow should be occurred, backward flow, blood flow should be backward. And another condition, damage to the heart muscle or pericardial muscle can be affected, and in future various type of cardiomyopathy can be developed. Damage the heart valve or other heart tissue can lead to irregular and chaotic heartbeat and atrial fibrillation and heart failure in the later life. And what are the diagnostic procedure or diagnosis of rheumatic fever? After that, the sign and symptom and medical history and physical examination and certain tests should be occurred. And in case of hematological test or blood test, the CRP, C-reactive protein, and ESR can be elevated due to it is a infection. It is a infection by group A streptococcus, and some streptococcal antibiotic or antibodies. Streptococcal antibodies detect the antibody to the streptococcal bacteria. That is called the ASO, anti-streptolysin O titer, ASO titer. It is a confirmatory diagnosis for rheumatic fever or rheumatic heart disease. Electrocardiogram or ECG is to know the electrical activity of the heart and diagnose the irregular heartbeat, and irregular heartbeat or enlarge the heart can be diagnosed. And echocardiogram shows the blood flow through the heart and heart valve, and motion of the heart can be diagnosed. And lifestyle and home, including the lifestyle and home remedy, and that is should be taken the green vegetables and seasonal fruits, and exercise regularly, and proper diet should be taken. Thank you.